and Hong Kong has been a space where things have evolved and support has evolved over the last few years, but it can be very difficult for people to find that support. And so our reason behind doing this webinar is because we recognize now that a lot of people don't even know that they might even need the support in the first place. And if they then recognize that they need it, where can they go? And so this is a sort of a short education around mental health in sort of early parenthood, as well as how we can support you. So I'm going to hand over to Dr. Kim, and she's going to introduce herself.
Hi, I am Dr. Kim, and I run Carter Family Therapy. I work with people across the developmental timeline, and I work with a lot of families. But obviously, as it goes professionally and in my obviously personal life, you have a child, and then everything changes. And it was for me being really blindsided by the mental health challenges of postpartum. I mean, look, but I've studied this. Like, how come this is so much harder than I thought it was going to be? And everything that I'd learned academically being put not to test, so to speak, and being really challenged. And this huge like transitional time that isn't spoken about enough. I'm now obviously very passionate about education and awareness, because across the board, no matter what, knowledge is a protective factor. Education is a protective factor. And if you know what's happening, it helps mediate any kind of symptoms or the struggles that you're going through. And so I'm really thankful to have such an amazing professional support community of women with aligned interests and values of getting the message and the information out there, because together we're better.
Yeah. Thank you. And Brittney.
Yeah, sorry, I'm just playing with the slides. My name is Brittney Tsang. I'm a certified birth, postpartum, and now loss doula. I'm currently completing my clinical placement in perinatal mental health counseling. And I'm also a survivor of perinatal mental health disorders, which we're going to talk a little bit about today. I struggled with postpartum depression and anxiety with my first and with my second. I'm a mom of two little boys. One is age 5 and the other is age 2. So I'm going to kind of get us started today talking about some of these things. So Michelle's done our welcome. I'm going to be looking at maternal mental health at a glance. So maternal mental health isn't just about avoiding depression, though so many of us only hear about postpartum depression. It's actually about the emotional well-being of a mother during pregnancy, birth, and postpartum. So the transition to parenthood is one of the most profound biopsychosocial shifts that anybody can actually go through, physically, hormonally, relationally, existentially. There's just a lot of things that we experience as we enter motherhood. And so kind of right after birth, estrogen and progesterone levels plummet up to 90%. As soon as the delivery of the baby and the placenta, our hormones just completely crash. And so this can cause mood instability, it can cause anxiety, tearfulness. And so about 70 to 80% of women experience what is known as baby blues. And so baby blues, can be anything from like mood swings to maybe weepiness, maybe some irritability and these things typically resolve within about 2 weeks postpartum. So these early days are biologically like super intense. But when these emotions that we feel, that kind of those mood swings, the weepiness, the irritability start becoming a little bit more intense and kind of expand past that 2 week time and persist or worsen, that's when we'll start looking at something called perinatal mood and anxiety disorders. So we often hear of postpartum depression, but actually, perinatal mood and anxiety disorders are an entire spectrum. This includes depression, anxiety, panic disorder, obsessive compulsive disorder, postpartum PTSD, bipolar disorders, and also psychosis. Um, so there's this whole span of disorders, and these are actually surprisingly common. They're very real. But the encouraging thing, if there is an encouraging thing about this, is that they're all treatable. So these disorders have been identified globally in one in every five women who've given birth. And so they do not discriminate. So it really doesn't depend on your income level, your ethnicity, your age, your culture, your circumstances. They really don't discriminate. And so we often want people to understand that this can affect anybody, from pregnancy through postpartum period, which we call the perinatal period, which is for about a year after giving birth. These can affect many, many people. And so this is kind of the global statistic, but there's actually a marked increase in prevalence of these perinatal mood and anxiety disorders for those who've experienced loss. So for those who are bereaved, perhaps have suffered pregnancy loss or perhaps infant loss, they're actually 4 times more likely to experience many of these symptoms and 7 times more likely to experience PTSD. So, for those who have experienced losses, this is a very, very serious reality. Um, so so globally, 1 in 5 mothers, experience a perinatal mental health disorder. But what's that like for us here in Hong Kong? Like, how does Hong Kong match up to this? And so, interestingly, there is a little bit of data. So here in Hong Kong, the numbers are actually slightly higher. So there was a recent study in 2024 that came out, and it was big. It was all over the news. In fact, globally, you've seen it go. People have been praising Hong Kong because it said that with the extension of maternal leave from 10 to 14 weeks, that postpartum depression rates had dropped significantly. But what's interesting about the article or about the data, the research, is if you start digging in it, the researchers actually found that still 31% had probable postpartum depression. So that's so much higher than even the global average. And so if you look at Hong Kong women, sorry.
And why do you think that is that Hong
That's
Kong?
a great question. So the data actually doesn't talk a lot about why. And that's a great area of research that, I would love to study on. But I think there's a lot of reasons why.
Interesting.
Yeah, I think there's a lot of there's this pressure that we put on ourselves as mothers here in Hong Kong, to bounce back, to be the perfect mother. There's like this stigma around I can't, I have to present myself a certain way. And so a lot of those things can cause, I mean, there's so many more answers to that question as well, but a great area of research to do in the future.
Our team of interns.
Yes, yeah, we were talking about that earlier. So, so 1 in 3 in Hong Kong, which is super surprising. And yeah, it really means that we have to, really care well for our mothers in Hong Kong, but also to spread awareness and help people know that, there are people who are experiencing, these conditions and they're not alone. Um, so another interesting article or area of research that was done just this year, uh, it was looking at the causes of maternal death in Hong Kong. And for, a long time, we've had this mindset that giving birth is super dangerous. It's scary, like, and we have so much fear around giving birth. But what was surprising about the research was that actually the maternal death rates for during childbirth are actually extremely low in Hong Kong. It's one of the safest places in the world to give birth, which is super encouraging. But what the data actually showed was that the leading cause of maternal death is actually suicide. And which is shocking. And it's saddening. And we've seen this a lot in the news recently, but it's actually not a new reality. This has been happening. Women have been struggling with their maternal health, I mean, for a long time. And so one of the researchers made a recommendation that perinatal mental health services must be enhanced to allow for early detection of depression, other mental health issues, and changes in social circumstances with the aim of eliminating the risk of suicide. And so I think this is just a call for us as a society to wake up and to make this an issue that we need to pour resources into and that we need to spread awareness about. So kind of looking at
Wait, but I just add on there. I think
yes,
that's such
please.
also an interesting piece of research that we know about and that is like that the government's aware of. Yet when we collectively do our research
Mm,
about what NGOs and what government support is available for mothers, it is such a dry research line,
yeah,
right? And then we talk about the majority of births that happen through the public system, and you're not encouraged to be very open there, right? Because and there's a lot of stigma within the public health system when anything is wrong with mummy and with mum. So right, it is so interesting, right? That we have the research, we have all the data that more needs to be done,
yeah,
yet on a systemic public service level,
yeah,
like women come last, right? Or
yeah,
and pregnant women and mothers are just not, it's such an afterthought and just like yeah, I know we'll talk about that
yeah,
later, but yeah, it's just
yeah,
interesting the mismatch of data and research and what's happening
yeah.
Mhm.
on
Yeah,
a individual.
I was chatting with a friend the other day who's a social worker and a researcher, and she was actually saying that there's Hong Kong is great in terms of research. Like we love research, but there's about a 20-year gap between, when we receive the research until we actually implement certain things. And so yeah, this research is quite new. They've only, this has been earlier this year. And I have seen, we'll talk about it in a bit when we're talking about resources, but I have seen a little bit of an effort. But it's mainly in the Cantonese speaking population as well. So I think in terms of English resources, like there's probably even less. But looking at the impact, maternal mental health doesn't exist in isolation. Like it impacts the entire family. So if when a mother struggles, bonding and attachment can be disrupted, partner relationships are strained, her physical health and her ability to care for existing children even begins to decline. And so the ripple effect works both ways, though. Like when a mother is supported, everyone benefits. And so we also, I want to draw attention also to paternal mental health, because that's one area that I think is also, important that we bring up is that actually studies show that 1 in 10 dads experience postpartum depression, and 5 to 15% can also develop one of the other perinatal mood and anxiety disorders that we mentioned, OCD, PTSD. They're at a greater risk if mom is also struggling with a perinatal mood and anxiety disorder. But yeah, 1 in 10 fathers as well, which so really, being able to support mom is beneficial for the whole family, but we also need to care for dad. And I think that's so important. I love Michelle's work with their dad groups is really, really important. So I hope this gives you just a little bit of insight into kind of like the overview of perinatal mental health disorders. I want to transition over to Kim now, who's kind of going to look a little bit deeper, as I've kind of given us a little bit of the broader picture. So Kim, Dr. Kim, I'll let you take it away.
So, obviously, I'm a clinical psychologist, and so I work with people on a one-on-one basis, right? And so, what I'll be talking about more is like the lived experience of maternal mental health, which comes under the microscope much more acutely in the postpartum timeframe. And then go to the next slide. And again, please, like I said, always better together. So there are things to add on here, right? So when we think about the postpartum experience, right, we can't think of postpartum without bringing up the word matrescence, right? The process of becoming a mother, which you verbalized so beautifully at the beginning, Brittney, which is there's all of the pillars of who you are, your life, and your identity are figuring out new definitions, right? The biology is changing, the relationships are changing. As a woman, your work situation is changing too. And unfortunately, and the emotional cost of bringing a new life and this like bundle of joy into the world is there's a normative amount of stress, right? And so all women, all families, it's a stressful time. Right? And like when I think of that, the time lapse of when like the cocoon of the caterpillar becomes a butterfly, right? And like when you watch it, it's chaotic, right? And birth is chaotic, and there are not enough narratives in the public sphere that are honest about that, right? In a way that we understand as a collective community. And I think much of therapy and the work that I do with all people, but it becomes, again, under a microscope in the postpartum period, the paradoxes of life and being able to tolerate two things that feel at the same time. And you're like, what? It's like, how do I make sense of this? And you're trying to make sense of life and these two truths while you're sleep deprived, right? With that huge hormonal shift. And your partner is also going through their own journey as well. And these new pillars of identity and this new relationship with life is happening in tandem with the most important job you've ever been given, right? It's like you're now so important to this little being. And human babies, unlike if human babies were to be born at a developmentally attuned time to other mammals, human babies would be born at 22 months. Right? So human babies are born useless, right? And because of that, they require so much giving and energy. And the research that you brought up about Hong Kong, the depression rates, I'd be really interested to look at the like mental health depression rates and like just capitalistic GDP rates as well of cities, because I think this process of reproduction and matrescence becoming a mother, developing a family is at direct odds with how civilized capitalistic culture demands human beings to be, right? Another paradox, right? So there's a lot of these factors that are happening at a social level that of course impact us as an individual level, right? And I think being able tolerating that distress, and especially if you've gone into birth and there's been less exposure, less narratives, you're away from lots of family, you didn't grow up seeing lots of babies, you're not surrounded by lots of babies, because it's motherhood and like taking care of a baby feels like a really niche topic, right? Because we're not exposed to it a lot. But women's health, maternal health isn't niche, but it's treated.
Yeah, you bring up a really good point, because if you look at more kind of collective societies, like maternal mental health, like, disorders, these perinatal, mood and anxiety disorders that we're talking about are actually seen at a much lower rate for very collective societies, whereas here in Hong Kong, we're super individualistic. You're looking at kind of the developed individualistic countries, you're seeing much higher rates. So I think you're spot on there.
Yeah.
And just to add to that as well, I love what you said there. That conflict, because even in training, so when I trained as a doctor, we don't focus on maternal mental health
Yeah.
at all. We
Yeah.
don't focus on the perinatal period at all.
Mm.
It's very much baby is in obstetrics and gynecology, baby is out pediatrics.
Yeah.
But what happens to care of the mum, the dad, the family as they become a family?
Mm-hmm.
There's nothing there. And what struck me when I became a mum, when I reflected on my education and realized that I knew nothing about this period of time, that I remember that we only had one lecture on postpartum depression at medical.
And it's black and white issue.
Yes, and it was very much, if you see a woman with these symptoms, please refer to your family doctor. And that was it. There wasn't any data that, there wasn't any kind of deep dive into why it might be happening. And very much I see in the work that we do, the biggest risk factors are the mums who have to go back to a very inflexible corporate job. And when I became a mum, maternal mat leave was 10 weeks. It's nothing. 14 weeks, it's still nothing, and to have to go back at such a vulnerable time, in terms of biologically at 4 months, our body is going through another massive change. Our babies are going through a massive change, but then nope, mum's back at work, and dad's having, your standard 5 days off. It's no wonder we have issues around mental health, especially in countries or in places like here in Hong Kong or in the UK, which despite its much longer maternity leave still has a huge problem because there is just not enough understanding around it and not enough support around it. So yeah, just thought I'd highlight that.
Yeah, no, and I'm right with you. My personal impetus for studying maternal mental health was in my 4-year degree around clinical psychology. Postpartum depression was such a non-topic, and again, seemed like such a black and white issue.
Yes,
and I think it speaks to a larger gender issue where women's health is just not as researched or considered. And I was like, oh, I need to study more, learn more. I think I've got another. Oh wait, sorry. Go back one slide. And I think an interesting statistic is so in terms of the mental health experience, another normative part of the postpartum timeframe is intrusive thoughts.
Yes,
and which typically, so again, 80% of mothers experience intrusive thoughts. Normative part of the postpartum experience. If we zoom out and look at mental health in general, these intrusive thoughts we only typically see with OCD and schizophrenia, usually. Whereas in postpartum, because the sleep deprivation, the vulnerabilities, it's like, oh, 80% of mothers. It's like, oh, and a little caveat, if they distress you, we consider that in my line of work a good sign, right? It's when these intrusive thoughts about hurting yourself, harming your baby don't distress you. They're like, oh, okay, now are we entering postpartum psychosis? Like, are we entering have this other reality where the world is actually, you are unsafe and that your child is unsafe? So I think it is really hard to discern when we look at like symptoms and how. That's why it's, again, the amount of research that's being done and the diagnosis part for these mental health disorders doesn't do this time frame justice, and it's not reflective of the lived experience. And another way to think about it is I conceptualize postpartum, again, a time of joy and birth, but it's also a time of grief, right? You have lost a lot, right? You've lost your typical sleep routine. You've lost how you used to relate to yourself and how you used to relate to your partner. And yes, like there's lots to be, again, these paradoxes, there's lots to be happy for, but you're also saying there's nothing as finite as having a child, right? Like life is sharp right turn, new chapter. this new person in your life that you have a relationship with, that your partner has a relationship with, and their own little lived experience. And again, so many factors, and it's a lot to process. And again, not always having the arenas and the spaces to be able to talk about that and to process it. And depending on what your attachment style is, will depend on how you need to process that. That's when we don't talk about things where shame can come up and stigma. So for the next slide. So ambiguity is one of the hardest phenomena for humans to tolerate. And like your baby just doesn't come with an instruction manual, right? And if parenting and baby life was simple, there would only be 1 or 2 books, right? Yet here we have like a plethora of strategies, approaches, like, are you doing baby-led weaning? Are you doing this? And all of this information is cyclical too, right? Obviously we have science, we're always testing hypotheses, but it's a struggle to feel like you're keeping up with the latest research, right? And so there's this huge area of the unknown. Am I doing it right? Like, am I causing lifelong damage, right? The stakes are so high, and it's a huge learning curve, and the amount of novel experiences in adult life diminish the older we get, right? And typically you decide to have a baby or you have a child when you're at a point in life where there's a certain level of certainty in most arenas. And that's why you think, I'm ready to have a baby. And then it's like, to learning what it's like to be a learner again, right? And starting from ground zero, figuring it out, and being compassionate and kind to yourself, as well as compassionate and kind to the support team around you, right? Because all being in it together, obviously a huge part of the postpartum experience. So with all these factors at play, and keeping in mind that a clinical diagnosis within the mental health arena is adjustment disorder, right? So a change that has happened in the last 2 months that you're having a hard time adjusting to, and that's a clinical diagnosis, right? It's like, okay, so we know that change is hard for humans. We know that we have a hard time adapting to that. So how could the postpartum timeframe like not cause mental distress, right? And for us to obviously not doom and gloom, but to acknowledge it for what it is and make sure that mothers and women and families are aware. And I always tell mums who are pregnant, right, to over prepare, right? Make sure there's a surplus of support. Because the hardest thing, I think, as a mother and a woman is to say, like, oh, actually, like, I need help, right? Especially when there's so much going on, right? Like, I need help. It's much easier to say, no, thank you, right? I'm good, I got this. Okay, my next slide. Okay, so signs and symptoms. And I always feel mixed about presenting this and talking about this, because in my humble opinion, the only thing matters is your subjective experience, right? And for you to be like, actually, like, this is hard, I don't feel good, and be able to then like look at resources and how you need support. Because the best case scenario, right, you go to a therapist and the therapist says like, oh, actually you're good, right? Like, actually, like, oh, this is what we need to do. But I think in terms of like how your medical like training went, right, there's this expectation that this isn't a time that requires energy and focus, and we just don't just like, oh, just get on with it. So, but anyway, the signs and symptoms. So obviously the emotional symptoms. We're all familiar with the sadness that comes with the hormonal changes, right, and the sleep deprivation. But remembering that actually when people are in pain and when people are hurting, it can go many different ways. How we express pain. So we have pain through sadness, and then we also have pain through anger and rage. And for a lot of women, they really experience it. They experiencing the injustices of the social factors that we have talked about today, right? And this huge responsibility of this woman's body that is, if you're breastfeeding, right, being the primary caretaker, especially in that initial stage where baby is so dependent on mum, it can bring up a lot of difficult feelings. And rage is definitely something that women aren't always socially allowed to express or feel like it's okay for them to be so angry. And then the anxiety, which obviously, we talk about postpartum depression, but the postpartum anxiety piece, tolerating that anxiety, the ambiguity, having all the worries, and those worries being excessive and valid, right? Like, oh, like, have I fed my baby enough? Like that's a real fear. Like that could potentially be a real problem.
Yeah.
And knowing what is a typical amount of worry to have and concern for your child, and where does that tip over into a clinical area? And the only piece of information that we have is anything that comes out of that baby blues timeframe of the 2 weeks. Anything after that, again, these are clinical symptoms. Also, interesting caveat that when it comes to clinical diagnosis, it will just be an anxiety, OCD, or depression diagnosis. Small note, with postpartum onset, right? Like it's not its own diagnosis or anything. So again, signs and symptoms, this is a really generic slide because it's a really generic diagnosis, which again is a huge discredit to this postpartum timeframe. And yeah, so the mood swings, which we know that in part due to the hormonal different changes that are happening. Behavioral symptoms, as it is with depression and anxiety, and we're looking for changes. And I put that note on the bottom, right? External changes of behavior indicate internal differences. So when you're thinking differently, you're going to behave differently. And this is more for partners or friends and family, right? You know who this person was before they had a baby, right? And you almost become that measuring stick. And I think as a community and as a collective, paying closer attention to mothers, and when we notice these differences, using that as impetus to check in with mums and be like, hey, just wanna, how are things going? And I think making questions as specific as possible, like what's going well, what's more difficult than you thought it was going to be, right? We're like, how are you? Like, fine. It's good. It's good. It's good. Because we also assume that people don't have the capacity to hold on to our
burdens.
Yeah.
Yeah.
Yeah, and then obviously difficulty bonding with your baby, and that part of not feeling that connection, I think that warrants talking about, right? And not in a way that is stigmatized or shame-based, but that might not come naturally for you, right? Depending on what your birth experience was, you might have resentment towards your child. Depending on how your partner is acting towards you and how he is integrating into this new chapter of family life, it would be very easy to then hold resentment towards the baby, which would make it a struggle in building up that attachment. And that's okay, as long as we talk about it and don't hold on to shame around that. And then obviously the cognitive symptoms, which again I struggle with because a lot of these cognitive symptoms just sound like sleep deprivation, right? And it's the differentiation part is really difficult, and to me, almost like the least important part of the postpartum experience, right? Like mothers are struggling. There's varying levels of support that they need. And as long as we talk about it and we recognize the symptoms within one another, and it's a conversation we're all willing and able to have. Yeah. Go on the next slide. Oh yeah, so yeah, physical symptoms, right? Again, these are just like fatigue, sleep disturbances, and things that are, when you were talking about the different kinds of, PMADs, diagnosable issues, something that isn't talked about enough, I think, is like complex PTSD. And for lots of, this interesting statistic that got shared with me just the other day, in the UK, the percentage of mothers who are giving birth, but they themselves are motherless, so they don't have a relationship with their own mum, and their your own family relationships, your own family of origin and childhood. What a time to reflect, right? You're also on maternity leave by yourself, alone with your own thoughts more. And most women are very reflective and contemplative, right? And it's like, oh, like what kind of mum am I going to be? And if the only other narrative you have of motherhood is your own relationship with your mum, other things come to the surface, and that it can bring on a plethora of symptoms. And also when we look at trauma as well, birth is can be a very traumatic experience for lots of women. And if you're not given the time and space to process that, there can be secondary symptoms from a mental health standpoint that take time to heal. Okay, we can, and obviously, if you notice that your partner is now drinking more or doing recreational drugs in the postpartum time frame, pretty big red flag that needs to be addressed. All right, but yeah, move on to the next slide.
Do you just want to touch on like thoughts of self-harm or harm to baby?
Yes,
Oh, it's the next slide. Gotcha.
It is right. Sorry, we go back. Yeah. Another symptom as well, right? In terms of the thoughts of self-harm and harming your baby. Although the majority of people who will experience these thoughts don't go on to harm themselves or harm the baby, it is the red flag that needs to be addressed, right? And if you're having those thoughts that can be a part of the process, unfortunately, depending on, again, varying levels of stress, but that's a sign to get help, right? Because again, the risk is too high, and there are just so many factors that are happening there. Again, relationship part, hormonal part, change in sleep, that if you're experiencing those thoughts, your mind is putting you at harm. Not necessarily you're putting yourself at harm, but your mind needs to be taken care of. The same way, if your liver wasn't able to properly take care of, like, digest sugar, would that be the right term? Process sugar.
Well, you can just talk about processing.
Processing sugar.
Yeah.
Right. Like, we need to take care of your liver, right? Your liver's causing you harm. The same way, if your brain is creating intrusive thoughts about you hurting yourself or you hurting the baby, right? Wouldn't things be easier if, I wasn't here, the baby wasn't here? Oh, okay. My brain is not being kind to me. My brain, I need to take care of my health, right? I need to take care of my brain. And I think what's really hard about when we think about mental health versus thinking about other parts of our body, our brain takes us on a journey with it, right? Our other organs don't take us on an emotional journey. It'll just be a physiological journey. And so being able to know that it's having these thoughts doesn't make you a bad mum, also doesn't mean that your child's going to be taken away from you, but it means that you need to take care of you, not just for your own sake, but in the postpartum time frame. I'm of the humble belief that no one is more important than the mother, right? Like, your baby needs you to be well. So you need to make sure that, but you've got to be responsible for yourself and making sure you're well. But it's obviously a very, very delicate time. And again, we live in a society where women's health is a secondary thought. It's a niche subject. So of course, when you are a woman and you're supposed to be responsible for yourself, you're like, oh, like, I should eat last. I should make sure my husband's stressed, he's okay. I should make sure my baby's okay. Like, it's like, no, I think mums need to learn to eat first, right? Because, like you say, we are the foundation of the family, of our family's health system, and especially in the postpartum timeframe, we're the foundation of our baby's health system. Unaddressed mental health issues typically don't get better, they get worse, or they show up in other arenas of our life. And they can also, something on the impact slide, it can also impact your baby's developmental trajectory too, when it comes to cognitive and milestone development. But I don't like sharing that one because I think that also puts more stress on mums and can sometimes make them feel worse about themselves. So I'm always mindful of how that one gets shared.
Can I just add to that as well? That sometimes, I've spoken about this a few times with friends and other professionals about how, when to that note about your brain and those intrusive thoughts and how it behaves differently in terms of like alerting us as to there's something going on, something wrong, again, anatomically, if you can't pee for 2 days, you definitely know there's something wrong, right? Or you suddenly go jaundice, there's something telling you that. our brain is very clever at playing tricks on us, but I think we're also very, we are now living again in an age where we are almost expected to dampen our instincts, and to just push through it. Keep calm and carry on, as the Brits say, we just soldier on. But those sirens, we talk about those sirens going off in your head, but no one is hearing it. The only way for other people to hear those sirens is for you to vocalize it. And as someone who didn't vocalize, but my husband, did see, because my behavior wasn't as it was pre baby. That's great when other external sources can recognize that, but it can be very difficult for oneself to admit that those things are going on. And so, I think we have to learn to be better at being vulnerable. And I think right now, especially in Hong Kong's climate is, you can't show weakness. Gotta keep going. And that in itself is sad. It's a problem. So yeah. Anyway, I want us to get through it. But yeah,
and I think
my two thoughts on that.
And I wrote here, like, talking about problems doesn't make them bigger.
Yeah, absolutely.
Right. But it can be scary, like, oh, putting that burden on someone else. Or like, if I talk about it, does it make the problem real? And actually, when thoughts are the most scary, when the only place they live is inside our heads. And once we start verbalizing it, getting it out there, it's like, oh, right, like, and also perhaps giving other people the opportunity to share their story, or other people just holding space for it. Sometimes when the thought leaves our brain, it's like, oh, actually, that's not true, or I feel better. It's like shame and stigma. Stigma is created when we feel like we can't talk about things, right? So there's stigma around the HIV crisis because no one wanted to talk about it, right? And then once we started talking about it, research being done and people finding ways to, like, treatment and care. Not that HIV became anything to celebrate, but it became something like, oh, like,
we can openly
talk about it, and like it's no big a manageable issue, right? So go to my next
So
slide.
we have about 10 minutes total, just mindful of time.
Thanks. And then
Oh, it's me anyway.
Yeah.
Is there anything else you want to add? Going back to since we have about 10 more minutes.
We're good.
Yeah.
I mean, if our participants would like to
ask any questions,
write
any questions.
I'll kind of run through the support first, and then if we do, we can open up for questions at the last couple of minutes. So thank you, Kim. I just want to close with talking about, like, kind of what we can do with this, really useful information that Dr. Kim has beautifully shared with us. Like, I appreciate just how you narrate, like, this experience. Like, it's intense, but I think you also point out, the hope in and the beauty in, this matrescence experience. And so thank you for doing that so beautifully. So, the next couple of slides, we're just going to talk about how we can, hold space, as Dr. Kim was talking about, how we can offer support, and how we can guide mothers and families toward help. So as I mentioned, it's so important to kind of to mention the hope. So all perinatal mental health disorders are treatable. And I kind of use this diagram in Postpartum Support International does as well, where it's kind of talking about, like, this is kind of, the treatment options, psychoeducation and preparation. We spend so much time preparing for the birth of the baby, but we really don't focus on what comes after. And so that is really so important. So if we can actually be, educating mothers about, this experience, this, fourth trimester experience that can actually happen during pregnancy, if we can be incorporating that into, kind of antenatal, you know, courses and stuff, like, women can feel like, oh, okay, like, this what I'm experiencing is actually normal. It's quite common, and I can get help. Um, Medical evaluation and treatment, for all of these disorders, like seeking medical support. There are medications that are available that are, safe to use during pregnancy and postpartum. And so I think that's really important to mention for those who might feel that medication is something that, them and their doctor have decided is necessary. Mental health counseling, of course, and I just want to highlight that also having a mental health counselor who has an understanding of the perinatal period is really beneficial. Like, I mean, m most mental health therapists, will work with a number of these conditions, but having someone who has, a specialized understanding is really important, like Dr. Kim. So I think it's really helpful and beneficial. And then social support and practical help. And this is really where we as caretakers of other mothers in our lives can really make a difference. And so, for anyone supporting a new parent, whether as a partner, a friend, a helper, there are kind of 5 key steps that make a huge difference. Listening, like truly listening, not responding, but just there to understand their experience. In the responding, validating before we're just trying to fix. I've read a number of cases where moms, who were having these experiences were sharing with their loved ones, and their loved ones were just like, oh, it's fine. You'll get over it. Like it'll pass soon. And so, we can very quickly want to fix. But phrases like "you're not alone," that sounds really hard, go a long way. There is help. Like you can be well. And so in terms of support, like taking initiative. So, whether it's, bringing a meal or going over and holding the baby while she can sleep for a few hours or, taking something off the family's plate. These actual, ways in which we can tangibly support are really important. And then referring, gently connecting them to help is really important. In my experience, like I couldn't get help for myself. Like I knew it existed, but I couldn't reach out for help. And I so wish I would have had someone in my life who was like, let me make that call to Dr. Kim and let me get you the help that you need. Like that would have been, let me go with you. I'll sit in her lovely waiting area and while you go in for the appointment and I'll hold your baby like while you go in or bring your baby. That's why having a, when I started therapy, I was bringing my baby. So that was actually really incredible. So, gently offering to connect them to help. And whether that's a support group or a therapist, and we'll kind of talk about those options here in a minute. And then following up, help is not linear. So consistent check-ins, with mom, more matter way more than grand gestures. And so support doesn't have to be perfect, but it just needs to be present. And I think that's so important for us is that like we often as caretakers are like, how do I help this mom? Like, but really just being present is matters so deeply to her. Validating her experience, normalizing her experience is incredibly beneficial. And so we just want to point out some, support resources here in Hong Kong. So we're fortunate enough to have some resources, though we certainly